A few months ago, Border Patrol officers intercepted 11 Chinese migrants at the border, hiding inside a washing machine, a dresser, and other pieces of furniture inside a moving truck. A month earlier, 6 Chinese migrants had been caught hiding inside the fake wall of another truck. The president of the National Border Patrol Council said on February 10th that 3 Chinese nationals were apprehended illegally entering Texas with flu-like symptoms and had to be quarantined. With coronavirus taking over the global headlines and health experts expressing panic about it, one thing you're sure not to find is any healthcare expert or TDS-infected political pundit to talk about the real danger here, and it's not coronavirus. Coronavirus didn't come from West Virginia or Texas. It's not a domestic disease. Nope. It's a foreign disease. A potentially deadly foreign virus, originating thousands of miles away, got into America, resulting in sickness and death, and shut down a large portion of the economy, and in response, billions of taxpayer dollars will be spent because of this. If there's one thing to take away from the coronavirus epidemic, it's that our inability to control who comes into our country is a serious threat to Americans and our way of life. Whether it's people coming in by airplane, or by boat, or Middle Eastern refugee resettlements, or illegal sneaking over our southern border, open borders makes you sick. And if America doesn't have control over our borders, we are vulnerable to the worst the world has to offer. So while other people lament Trump as the worst president ever because he's not stopping the coronavirus, let us remind you where the hotbeds of the coronavirus are taking place. Washington, California, New York. In other words, the most anti-Trump places, the most open borders type places, the sanctuary states have the most coronavirus outbreaks. Even after Trump shuts down travel from Europe, despite Europe being the new epicenter of the coronavirus outbreak, Joe Biden thinks, along with many other Democrats, think we should just keep bringing them in. Who says open borders make you sick? That's xenophobic and racist and stuff, but it's not. In fact, disease coming into America from foreign countries happens regularly, and it's getting worse. And good luck finding any doctor willing to speak out about the dangerous health consequences of not controlling who comes into the country. In Los Angeles, there has been at least 124 cases of typhus. America hasn't had much of a history of typhus, but Mexico did. Typhus was so associated with Mexico that it was even known as Mexican typhus fever. The case of typhus in Southern California was linked to Mexican refugees. Even the deputy city attorney, Liz Greenwood, was infected with typhus. Texas saw a surge of typhus cases between 2008 and 2016, and the cases have been heavily concentrated in counties with high illegal populations. The number of typhus cases rose from 30 in 2003 to 519 in 2017. Gee, and the typhus outbreak seems to be located in places hot with illegal immigrants, doesn't it? Typhus had fallen off the radar in the US. It had been even delisted by the CDC in 1994, and then in the mid to late 90s it made a comeback when our borders began to open. But typhus is just the start. Last year, Border Patrol was on pace to refer over 31,000 illegal aliens for medical treatment. We now know that there were close to 200 individuals in Texas ICE facilities who contracted mumps. Reuters reported that ICE health officials have been notified of 236 confirmed or probable cases of mumps among detainees in 51 facilities, and that as of March 7th, a total of 2,287 detainees were quarantined around the country. According to the Tijuana Health Department, 1/3 of the caravan migrants who stayed in the region were treated for health issues, including tuberculosis, HIV or AIDS, chickenpox, lice, skin infections, and hepatitis. One Honduran migrant on her way in a caravan spoke to the AP and revealed that she has HIV. Why are we bringing in people with HIV? I don't understand. Out of 6,000 migrants currently residing in the city, over 1/3 are being treated for health-related issues. Guatemalans are 83 times more likely to have tuberculosis than Americans, and 7 times more likely than legal immigrants, according to the CDC. Just 1 month before the largest caravan left for the US in October of 2018, 5,500 cases of mumps were reported in Honduras. In 2016, federal officials confirmed 22 cases of measles in an Arizona detention center. Between Texas, California, and New York, we have 50% of the cases of tuberculosis, and the border has the most. According to Texas Health and Human Services, 61.4% of tuberculosis cases were associated with immigrants, and rates are even higher along the Texas-Mexico border. The latent tuberculosis rate of 43% among refugees in San Diego County from sub-Saharan Africa is more than 10 times greater than the latent tuberculosis rate found in the general population, according to a 2013 study. 16 refugees were diagnosed with active tuberculosis in Colorado between 2011 and 2014, 19 in Michigan between 2011 and 2016. 11 Muslim refugees in Ohio were found to have active tuberculosis in the past 6 years. 2 healthcare workers in Minnesota hospitals also were diagnosed with tuberculosis, both immigrants from Somalia. Between 2012 2012 and 2015, 1,565 refugees were diagnosed with active tuberculosis in the U.S., according to the CDC. The CDC data, which has been public but obscure until now, shows that the number of refugees diagnosed with active tuberculosis in recent years is more than 3 times greater than previously reported by any media outlet. Data reported to the National Tuberculosis Surveillance System shows that tuberculosis among foreign-born people in the U.S. is approximately 13 times greater than U.S.-born people. Moreover, a 2002 CDC study shows that countries that have recently taken in a number of third-world immigrants are seeing a relatively high prevalence of tuberculosis among the new immigrants. Today, the proportion of immigrants among persons reported as having TB exceeds 50% in several European countries, including Denmark, Israel, the Netherlands, Norway, Sweden, and Switzerland. A similar proportion has been predicted in the U.S. Every doctor should be vigilantly anti-open borders and anti-sanctuary city due to the astronomical public health risks they cause. But good luck finding physicians tweeting about how dangerous our lack of border enforcement and sanctuary policies are. Doctors have nothing to say about it. God forbid political commentators on Fox mention the health risks of open borders. Newsweek would attack Laura Ingraham for calling the migrant caravan a health issue. The Daily Beast and others would follow, attacking anyone who suggests open borders and sanctuary cities are serious health issues. It hasn't always been that way, though. In 1893, Congress passed a law updating mandates on quarantining any vessel suspected of containing those with disease to ensure that the American population would never be placed in danger. As early as 1907, we passed laws singling out those with tuberculosis for exclusion into coming into the country. At Ellis Island, everyone was forced to stop at a quarantine spot and nobody could pass until officials were sure they did not constitute a threat. Immigrants were to come through Ellis Island, which was a man-made island, to prevent immigrants from walking right into the country with diseases and affecting Americans. But here we are 112 years later, and we've gone backwards, inviting a population that is 83 times more likely to have tuberculosis than Americans, and instead of turning them back, we're on the hook for their medical care. But despite leftists accusing Republicans of killing people by not giving them free health care, unfettered immigration is a serious threat to America's healthcare system. Tuberculosis' deadly return is now lethal for about 60% of those infected with a new multi-drug resistant tuberculosis. Until recently, multi-drug resistant tuberculosis was an endemic in Mexico. This tuberculosis is resistant to at least 2 major anti-tubercular drugs. Ordinary tuberculosis usually is cured in 6 months with 4 drugs that cost about $2,000. But multi-drug resistant tuberculosis takes about 24 months with many expensive drugs that cost around $250,000. And guess who's on the hook for paying that bill? You, Mr. and Mrs. Taxpayer, as well as hospitals who may get some form of payment from emergency Medicaid, but still ends up in the red, losing money on the deal. In 2016, a visiting woman gave birth to a baby with the Zika virus. The estimated cost of caring for the Zika-infected baby, between $1 million and $10 million over the course of the child's first 18 years of life. And the woman had been in America for approximately 30 some odd days. Lucky her, right? She just so happened to come into America when she gave birth to a Zika virus-infected baby. What a coincidence. Guess who pays for all her medical care? This burden that these foreign diseases bring onto our healthcare system is a serious threat to hundreds of hospitals. A study found that 84 California hospitals closed their doors as a direct result of the rising number of illegal aliens and their non-reimbursed tax on the healthcare system. Anchor babies, the babies born to illegals, instantly qualify as citizens for welfare benefits and have caused enormous rises in Medicaid costs and stipends under supplemental security income and disability income. In addition, many illegals harbor fatal diseases that American medicine fought and vanquished long ago. While politicians often mention there are 43 million without health insurance, a report estimates that at least 25% of those are illegal immigrants, but the figure could be as high as 50%. In 2003, in Stockton, California, 70% of the 2,300 babies born in San Joaquin General Hospital's maternity ward were anchor babies, and 45% of Stockton children under age 6 are Latino. In 1994, almost 75,000 anchor babies in California hospital maternity units cost $215 million and constituted 36% of all Medi-Cal, which is California's Medicaid program. And today, in 2020, they most certainly cost more than that. The CBO projects that between 40% to 50% of hospitals could have negative margins by 2025 under current law. Given that Medicaid already pays hospitals below their costs, the Medicare Payment Advisory Commission estimates that Medicare hospital margins will be negative 11%, but hospitals in rural places are at even greater risk of closure. A new analysis of U.S. rural hospitals has found that offering a government insurance program reimbursing at Medicare rates as a public option on the health insurance exchanges created by Obamacare could place as many as 55% of rural hospitals, or over 1,000 hospitals across 46 states, at high risk of closure. Remember, Democrats want this government health care. The rural hospitals at high risk represent more than 63,000 staffed beds and 420,000 employees. In other words, government control of healthcare would potentially eliminate services and reduce clinical and administrative staff, as well as damage the economic foundation of the communities that these hospitals serve, particularly rural areas. So if Democrats get their way and get control of healthcare, hospitals serving residents in rural areas are under serious threat. But why is it so much the rural hospitals? Could it be because that people in these areas have greater health defects? Perhaps. Or could it be that in rural areas are even more likely to employ illegal immigrant farmhands that don't have health insurance and end up using healthcare for free? But the American Hospital Association, who produces this report, doesn't say any of this. In fact, it's obvious in the language they use in the report that they deliberately conceal this, calling it a reduction in costs instead of saying what the actual studies they're citing say, which is that a Democrat-controlled public option would destroy the healthcare system, particularly in rural areas who are under heavy stress with illegal immigrant populations. America's inability to control our borders and the commitment of Democrats to make sure we never have border control is bringing in disease, infecting Americans, and burdening our healthcare system to such an extent that hundreds of hospitals are under serious threat of going bankrupt and thereby endangering more Americans by limiting their ability to even get care. What's more discouraging about it is you'll be hard-pressed to find doctors who are certainly aware of these dangers, but don't care enough to say anything about it, for fear that Democrats call them one of the many names they call Republicans on a regular basis. But through their silence, doctors have become accomplices in further endangering the health of Americans.